So I'd love to hear you speak to as a doctor and a functional doctor that specializes in this area. Why is the excess toxic load and the stealth infections, why is that so easy to miss with conventional testing? And how do we go about trying to navigate this really?
Yeah, good question. This is one of the most popular questions I get actually, because people are really confused. They're like, I got a Lyme test from my doc and it was negative, and they don't understand. And first of all, if you guys are listening and that's happened to you, it's designed that way. I truly believe that. Truly believe there's a cover up about how detrimental and chronic Lyme is and how common. It's more common than breast cancer with up to 300,000 cases per year per the CDC recently. So, I truly believe that there are lots of people with this, and they're confused about how to get proper testing. So, one of the ways that I suggest for you guys is to understand the best test. And if your PCP won't order it, you can always look for a functional medicine provider or practitioner who knows what test to order. There is one that they can order themselves out there called DNA Connections. It's a urine test. They provocate before the test, you guys, which means they get you to sweat. They get you to get a lymph massage, do something to shake those suckers out of their hiding place. So what that should tell you, just based on that testing, those testing instructions alone, is that, gosh, this bacteria hides extremely well, or it's parasitic co-infections. They are stealth infections. Do you guys think they're bad at their job? They have been around as long as we have, if not longer. They are not bad at their job. They're pros. And our testing is really archaic. It hasn't changed in 30 to 50 years. It hasn't been updated, you guys. The ELISA screening test, which most docs know not to do now, misses up to 80 to 90% of cases. The Western blot still can miss up to 40% of cases, depending on where you are in your Lyme progression. And so I think that you can get a better result with the Western blot with sweating and binders. I do. I do believe that, if that's the only option you've got. I know that you can do great with things like iGenix, Vibrant Lyme Panel, who I really like. They're only $450, and they've given me some pretty accurate results. And that's as cheap as I can get a Lyme test for most people if you want an accurate Lyme test. DNA Connections, the urine test I just spoke of, is about $650. iGenix, I got mad at. To get a full Lyme panel, it's about $1,500 to $1,800, and they don't take insurance, so I quit using them. But that's really the honest truth about Lyme, you guys. This is a bacteria that's corkscrew shaped. So remember, form follows function. So that means it likes to burrow, because it's like a nail, a little corkscrew nail. They'll just burrow right into tissues, bone, cranial tissue, joints, mucous membranes. It doesn't hang out in the blood. So when you test that, it doesn't always show up. And a lot of the tests, like the Western blot, are testing your body's indirect antibody response to seeing the pathogen. So if your body doesn't really mount a very good immune response, we may miss it. So to increase the efficacy and hopefully get a positive result, if you're looking for answers, make sure you do something like kill, bind, sweat a couple days beforehand so that you can get a more positive result for yourself.
Absolutely. Well, and
Yeah.
certainly, I like the word stealth infection, or the phrase. I think it's very accurate, and kind of this idea of microbial imbalances and stealth infections where, you look at Borrelia, and I love how you said that with the form and function, and, it can change its surface proteins to hide from the immune system and stuff. And it's just like, what, there's even some kind of conspiracy theories out there on like, oh, this was engineered to like totally screw us up,
I
which,
do I do believe that some.
yeah,
Um,
yeah.
they say it's climate change that's made it change its territory, but it's very interesting. I do think that our government has been very interested in vector-based diseases for a long time. I'll just say that.
Absolutely.